5 o'clock, Mr. Chair.
The meeting of the Board of Ellis County Commissioners will now come to order. Let's stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Donna, you can call the roll.
Commissioner Dean Hazelhorse.
Present.
Chair Butch Schleier.
Present.
Commissioner Dustin Rock.
Present.
You have a quorum present.
Okay. Any changes to the order of business?
I have none.
Jason Kennedy would like to be added,
Yes.
probably around the sheriff's
Okay.
line item. We'd like to talk about the COVID-19.
Put him in at 11 or 9.
And I say that around the 9th, around
Okay.
that, because he's,
And should
Their
the consultants come in for the county administrator search, if they come in sooner, we'll put them ahead of the budget too. Okay. Prior minutes, March 9th. Do we have any concerns?
Fine to me.
Aye.
Okay. Minutes stand as submitted. Do I hear a motion for the consent agenda?
I'll make a motion to approve the consent agenda items A through G.
I second that.
Have a motion and a second. All in favor say aye.
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 Motion carries 3-0. Any issues from persons not on the order of business? Okay. Monthly department report. Fellow commissioners, did you get to review that?
Yep.
Yes, I did.
Look good as always. They did a great job.
Okay, very good, very thorough. County policy enforcement. This concerns our purchase card policy. Fellow commissioners, you are aware that our county treasurer, Lisa Schlegel, has not been providing some of the requested documentation on the use of the purchase card. And we need to discuss just how we want to address that, as we have policy regarding that. There have been several attempts by Human Resources to get the required documentation, and the treasurer has not been willing at all to cooperate with those inquiries. Darren and myself requested a meeting with the treasurer to discuss this, and she sent a response that was, I guess, arrogant as well as disrespectful. I felt it was disrespectful not only to the Board of Commissioners, but to her fellow elected officials, to her fellow department heads, and to every taxpayer who supports the Treasury. And it was very arrogant from the respect that she doesn't feel like she has to account to anybody for those receipts or the documentation of who's attending the meetings. We as a County Board of Commissioners, it is our responsibility to provide departments with their budgetary funding. It is also our responsibility to make sure that we provide the necessary oversight to be sure that all of the money expended in the departments is in the best interest of the taxpayers. And we can't do that without proper documentation on some of these different types of invoices or receipts. So we need to look at what we are going to do. We expect our treasurer to follow policy. We also have to follow policy. And I think following the advice of Bill Jeter, what we need to do is suspend her use of the purchase card for 30 days. Is that correct, Darren?
correct, that's what the policy states.
That's what the
Step
policy
2.
states. For 30 days, she could have the purchase card back after 30 days. If there's any further noncompliance while using that credit card, it'll be suspended for an indefinite period of time. Are we in favor of that, Commissioners?
Yes, sir.
Mr. Ross?
Chair Schleier, just did she notate that did she have any indication of whether or not she had a problem with our policies, or I imagine she had signed paperwork about the policies when she picked up her P card, correct?
When she hadn't signed for the purchase card, when I was elected commissioner and I got my purchase card, I had a meeting with Phil, and he said he was having a difficult time getting the treasurer to sign for her purchase card. He still hadn't gotten the signature. At that point in time, I sent an email to Lisa, requested that she sign the documentation. The documentation does note that you're aware of the policies.
Right.
And she did promptly sign and return that to Administrator Phil Smith-Haynes.
Okay.
So she should be aware of the policies.
Yeah.
She just simply states in her email response, she doesn't think they apply to her. She runs the Treasury, and it's nobody else's business but her own. So,
Yeah, I would say if she has a disagreement with the policy, she can sure come to us with that disagreement and allow us to discuss it. But until such time, it is the policy, and it's what we've got to go by.
absolutely, and it does help us provide oversight on some of those expenditures.
And I don't think that the oversight is overstepping our bounds. I mean, knowing who a meeting is done with when you're using taxpayer money to pay for the meal seems like our business 100%.
But anytime you do a meeting and you're going to use a purchase card, we should be aware of who was at the meeting and what the meeting was about.
Yep.
That's just pretty basic.
And just the use of it here in Hayes, I think, has been abused.
That's very possible,
I mean,
Commissioner.
just looking at the other department heads that also have P cards as we do too, Commissioners. I mean, it clearly states in there, if you go to a meeting in Hayes, with a fellow employee or how it is, I mean, it clearly states the policy with that. And her response to Janet Schmidt in HR was just, I thought it was uncalled for. It was a very unprofessional response back to Janet. I mean, she oversees HR for the entire county.
That's absolutely correct.
And me being here 12 years or starting my 12th year, I've never seen a response like that ever to anybody in HR. But I mean, it was just very uncalled for, very unprofessional.
I think let's move forward. From my perspective, a 30-day suspension. I think if we're asking people to follow policy, we follow policy as well.
Okay, so Darren, beginning tomorrow, her purchase card will be suspended for a period of 30 days.
Understand. We'll make that, make the changes online.
Okay.
Mr. Chairman, I'd like to also discuss this note that was handed to me, posted around
Yes.
windows. Do we want to do that now or under Commissioner reports?
We could do it now.
That's your call,
Yeah, let's do it now.
okay? And I guess, Darren, you wasn't aware of this until until it got brought to your attention, until we was like, give or take 30 minutes ago. I guess, and Jason isn't here, is he? Is Jason here yet?
Jason's
No,
not here.
Jason's not here, okay. Okay. From what I understand, from what Jason's, and you were at that meeting this morning, correct? With
Correct.
Jason? Okay. I guess from what this says, from what Jason said, is basically the opposite. I think going forward, we need to follow what our health director states. We don't need to have department heads, elected officials, whatever, printing up their own things and putting it out before before the commission knows. I don't think none of you was aware of this, was
Wasn't
you?
aware of this at all until I
Dustin,
seen
were
it.
you aware of this?
I was not aware of it.
I didn't figure so.
Just when I walked up to the building today.
And neither was the interim county administrator again. I think he needs to be in the loop, and I think he would probably have brought us in the loop before we make changes over and above. There's a reason we have Jason Kennedy on staff, and right now in this time, whether the whole coronavirus is ever going to hit Ellis County, we don't know, but there's a reason we followed Jason's policy. There's a reason he's in charge of that, and we need to follow his guidance, and I think you need to make that very clear to him also, Darren, that this here is just uncalled for. I mean, we now have to make an appointment to go to the treasurer office. You didn't know about it. You're the interim county administrator. You, of all people, should have seen this before it ever went public. I think it's very unprofessional, very uncalled for. I mean, there's a reason we have people in place. Bill Jeter never had time to review this. I don't think, Bill, have you seen this yet?
County Councilor Bill Jeter. I just saw it before the meeting started.
Okay, so
I would
you,
remind the commissioners, though, that the treasurer is an elected official, and she has the right to make decisions in terms of the operation of her office. You can set her operational hours, you can set her budget, you obviously approve expenditures that come out of her office as needing to be for a public purpose, but you are very limited in what you can do, if anything, in terms of the operation itself of her office.
And Mr. Jeter, I don't disagree with that. I think it would have been more professional for our treasurer if she would have discussed this with us
Yeah.
beforehand, so we would at least known what was going on and why it was going on.
Yeah.
yeah, there's nothing better than a surprise when you walk in the door.
Yes.
And when I asked Darren, he knew nothing about it, you know. Again, if we're going to change operations and do this and that, that should be brought before the commission.
It should be, absolutely.
So at least we know, so we know what's going on.
Now, doesn't this directly involve operational hours?
No,
Does
I
not?
don't think she's changing the hours
You
of
just
her
got to make an
operation.
appointment.
She's just changing how you would renew your tags, for example.
I'm assuming this comes from she doesn't want people waiting in the area up there? Is why one would
I have
need
no
to-
idea. She,
Yeah, I don't either.
Doesn't
She
state
wouldn't
that.
talk to me about it. so.
Mhm.
That doesn't state that. I'm just rereading it again.
No, it doesn't state it, but if you have an appointment, you shouldn't have to wait too long either. So there shouldn't be a crowd in the waiting area.
Shouldn't be a waiting line, right?
There shouldn't be.
And I'm just rereading it, but I don't see where it,
I guess what I'm saying, Mr. Chairman, is regardless of whether you don't like how she went about it or whether or not she even should do that, it's within her prerogative as an elected official and in determining how to operate her office.
And I definitely understand that, and I think my fellow commissioners here understand that too. I think, I could say though, in the 23 years I worked for the county, I've never seen a department head so disrespectful and uncooperative as a treasurer we now have. And it's just never been witnessed by me before. And I've had several encounters with all of our department heads and elected officials over the years.
I guess I just wish it would have came to us before we seen it posted on the window. I think that'd have been common courtesy. Darren, I'm just curious, did you invite the treasurer to the meeting tonight? Being she's on the agenda.
I did. The response I got did not indicate yes or no.
Okay. Thank you. He answered that question.
Okay, moving on.
Thank you.
The Fort Hays State University Leadership Class video.
Commissioners, Darren Myers, intern county administrator. Tonight, I have a couple students from the leadership, fieldwork leadership class out at Fort Hays. They are the producers of the video that we viewed last week, and I thought it would be good for them just to have some experience with some local county government. They did a good job putting the video in, so I thought it'd be great to have them come down tonight and meet the commission and kind of explain who they are, what they're doing, and kind of how they want to help us out in the coming months, even with the cancellation or online courses at Fort Hays. But they got some more ideas on how they like to help a couple of different departments. So I'll let
Great.
them introduce themselves.
Welcome.
I'm Braden Wisniewski.
And I'm Olivia Albrecht.
So originally we planned to go out into the community and spread awareness to about the mail-out ballot. But due to the recent concerns of the COVID-19, we chose to stay digital with things like videos and social media.
Yeah, so we had previously done the informational video that he showed last week. And like he said, we were gonna go out in the public, but we kind of changed our mind on that. And so primarily what we're gonna be doing is informational videos. So we're gonna kind of focus doing more on like the fire department, like emergency services, possibly public works. So we were gonna kind of maybe shadow them for like a day or something and kind of do more of a daily activities of what they do and kind of edit that into a video that Ellis County could maybe put like on their digital platforms, so like maybe Facebook, Twitter, something like that, just so like the county can kind of get a little bit more of idea of like maybe the daily life and kind of just inform them more of like how the sales tax and everything contributes, like if it was raised, what it would go towards, and like how those things are helped throughout Ellis County. So that's kind of what we're looking at, is more informational videos that Ellis County can kind of publish and kind of do whatever they want with. So
Sounds great.
I think that's a good idea. It does let the public be aware of what county personnel do and how it affects county citizens.
yeah, because that's kind of what we were focusing on, because we're also going to do probably like an awareness week. So like the week after the ballots are sent out, but the week before they have to be returned. So we're going to kind of push more for like digital promotions and stuff. So like we've talked about doing like maybe some more posters that could be put on Facebook and Twitter, and then possibly like a Snapchat filter that other people can use and just kind of share and bring more awareness to the whole sales tax ballot.
Good job on the video also. You guys did a good job.
Thank you.
Thanks.
Feel free to reach out to any of the elected officials or department heads, and I'd imagine most of them would be willing to help in any way they could with your guys' videos, and appreciate the work that you guys have done through the class. It was a really good, well put together video, even though you were dealing with Darren as subject matter. But
You can always move up to Bill Ring and Jason Kennedy. You know, we're not opposed.
sorry, Darren. No, thank you so much for the work on it. And yeah, for your safety, I'd say go ahead and stay in and work hard from there. And like I said, reach out to us if you have any questions. It definitely is my opinion that there's a lot of people that don't understand all the things that county government does, and those type of things really help them understand the taxes they pay when they get to looking at it. So thank you.
Thank you, guys.
Yeah.
Okay.
Yep, thanks for coming.
Thank you.
Thank you.
Okay, our health insurance consultant, Darren.
Good evening. Up here tonight, we have Julie Armour with Freedom Claims. We, as a wage and benefit committee, have met several times over the last couple months. We called in a couple different consultants, brokers, to look at assisting Ellis County with health insurance in the future. As we all know, health insurance costs are increasing, and over the last 5 years, Ellis County has seen an average of 8.9% annual increase for health insurance. So we invited in different consultants or brokers or both, and they gave us different options of being fully funded, partially funded, fully or self-funded completely, as well as what Julie has presented on having a fully funded policy backed up by a medical expense reimbursement program. And we took all the different accounts into play on what type of policies and they're looking at for coming off the state plan. And we kind of looked at not just the cost, but just the services provided. Some of the services provided I don't think would have been financial beneficial for the county to enter into any type of agreement with. And once we started looking at it, we started looking at our claims data from the past 5 years. We have different claims data from 3 of the last 5 years from the state. 2019 we haven't got yet, or we just haven't requested. But of the years 2015, 16, and 18, when you compare the premiums that we paid into the state compared to the expenses that they have paid out for both, or for medical, dental, and vision, we basically overpaid $690,000 in premiums over those 3 years. So the proposal that Julie had brought to us in trying to become partially self-insured with that medical expense reimbursement program, if we would have been into that type of program those years, that $690,000 estimated would have been able to keep into county coffers. We could keep a special fund for health insurance, and we would have those expenses in our own coffers, so that way we would, one, gain interest on them, two, help control cost increases over the next year, following years, or change the level of benefits, increase the level of benefits for employees. The Wage and Benefit Committee narrowed it down to 2 different consultants to work with, and ultimately sided with Julie Yarmer. And I guess with that, I will pass the torch over to her and let her kind of give you where she was at and what her proposal is to see if the commission will allow the Wage and Benefit Committee to work with her over the next couple months.
Thank you, Darren. Good evening. I'm Julie Yarmer with Freedom Claims out of Great Bend. We have a satellite office in Russell, and we're here to see what we can do to come in and design a program for the county that we can enhance the employee benefits, but yet save the county money. We work with several municipalities now. As Darren stated, with what we do and being a third-party administration office, right next to payroll is employee benefits. And it's so hard to control those costs, but yet be able to continue to give that employee that benefit. So what we've done is we've come in and we can take a look at the needs here and what you're looking for your employees. We can look at the fully insured cookie cutter plans, and then we have the medical expense reimbursement plan that Darren had touched on, or a partially self-funded plan. We have found that the medical expense reimbursement plan has worked well for employers on coming in and dividing that premium into two parts. So you're putting that money back to work for the county instead of, and building your reserves to be able to enhance those employee benefits, but yet build that reserves. I've got some samples here of how the plan works.
Thanks, Julie.
Thank you.
And the whole concept is that when you send that premium off to the insurance company, it's for this plan, here's your premium, here's your plan. So what we've done on the medical expense reimbursement plan, and inside the white packet is my business card, which is also a sample of the ID card. And what people do when they go to the doctor, hospital, or pharmacy, they present two cards. And whoever your umbrella carrier is, and we can work with all admitted carriers in Kansas, that they file, it's like a Medicare supplement. So they file the claim with the physician files the claim with the primary carrier, and it's paid according to the employee plan, the employer plan, and then it's submitted to Freedom Claims, and we pay it according to the employee's benefits. So you're actually just paying the actual claims on that and not paying more for the in case things happen. So on this plan design here, we've enhanced the employee benefits from what they currently have with the high deductible, but the whole time we've taken those premiums into two parts. You pay for the actual high deductible with the reinsurance or with the fully insured carrier, and you're paying actual claims. So if you actually go to page 6 of that, we're showing on this plan design, which we've enhanced the employee benefits, and of course these are on preliminary numbers that we would come up with for a January 1 of 2021. We're showing what your maximum liability would be if everybody on that plan met that high deductible. Next to that is the total. That is what you're actually putting in reserves. So you've funded reserves 138%. So everybody on that plan could meet that high deductible times 2 per family, and you would still have money in reserves. The whole time enhancing the employee benefits. We have found with this plan that employers have been able to keep the cost, the employees' out-of-pocket cost, the premium, the same for 2 to 3 years by using the reserves to offset any of those increases. You can use those reserves to enhance the employee benefits, and we've had some employers just fund that reserve 6 months out of the year. They've had enough built up in the reserves that they no longer have to fund those reserves. So the whole idea is to enhance the employee benefits and save the county money. We're there to do the full service. We're very hands-on. If whatever umbrella carrier that you have, the employee can contact our office. You will have a dedicated claims examiner that will assist the employees. I always tell everybody that my cell number is on my business card, that questions do not always come up Monday through Friday, 8 to 5. So we're there to give you that personalized customer service.
So Julie, each employee would have like a single plan or two plans?
They would have two cards.
Okay, two cards,
And
yes.
the umbrella carrier would be, the primary would be the employer plan with the high deductible.
Okay.
And then the Freedom Claims card would be the secondary.
Okay.
So it'd be a primary, secondary.
Okay.
So the employee would get two explanation of benefit sheets before they'd get the final bill. And the provider does the filing of those claims. So the employee doesn't have to bring us anything for any kind of reimbursement. We automate that with the Freedom Claims card.
So
So the initial savings is coming from our employees being on high deductible plans with a large insurance provider, and then a secondary policy that supplements those plans in order to lower their max out-of-pocket deductibles and essentially.
Correct. So the high deductible plan on the illustration here is $6,350. That's the employer plan. So that would be the county's plan.
Right.
And the employee's out-of-pocket on this illustration is actually with deductible and co-insurance only $3,500. So that would, right off the bat, wouldn't lessen the employee's out-of-pocket from where it currently is on the state plan. So as those claims come in, they send it to the umbrella carrier to be applied to that deductible, that high deductible, because once that's met, claims are covered in network at 100% by the umbrella carrier. Then with that second card, it comes in and we pay according to the employee's benefits. So we have the employer plan with the high deductible and then the employee's plan with the lesser out-of-pocket. The one service that we also provide is that when we come in and we'll look at all admitted carriers in Kansas, give the Wage and Benefit Committee different options, spread everything out, looking at the fully insured cookie cutter plans, the medical expense reimbursement plan, what is going to fit best for the county for savings for them. We also do that every year. So every year, and we do quarterly reviews, monthly reviews. Behind the illustration is what we call an aggregate report or a savings report. You get this report every month on what we paid in medical claims, what we paid in prescription claims, and what your savings has been. So we do regular reporting. Any reporting that you would like to see on how the claims come in, we're there to provide that reporting to you so that you know where your claims dollars, how they're working, and what your savings are.
Is there any kind of estimate of how much we can actually reduce the county's insurance expense?
The first year, I always recommend that you budget as if you were paying the full premium for that cookie cutter plan. And as we build up those reserves every year, you can reduce what you're paying. So you could see, if overall, maybe a 5 to 10% decrease or enhancing those benefits. It depends on how those claims are paid and how the reserves come in. After that first year, we'll be able to give you more information on the savings. But again, even if you come in and you get like the 8.9% increase or a 9% increase, that is on the premium for the high deductible. So if you have enough money in reserves, then that would absorb any kind of an increase to where you're able to still build reserves and not have to increase any cost to the employee, but yet still keep that out-of-pocket low for the employee.
Julie, you have anybody in the area that you have insured?
We do. We have the counties in the area. We have Ricks County, we have Thomas County, Logan County, Goat County. I do City of Russell. We do some smaller groups in the area, City of Ellis, City of La Crosse. We have quite a few groups in the area, yes.
Okay.
Does this also include the pharmacy benefits or dental and vision benefits?
Yes, what we've quoted here, it would include, we would come in and do a package deal to where we would look at the health, the prescription, the dental, and the vision to put a package together just like you have with the state.
Janet has something to say.
Okay. Janet?
Hi, I'm Janet Schmidt, HR Generalist, and I got the task of doing a background check or checking with other counties, other entities.
How'd that work for you?
Oh, I was like totally amazed. There wasn't a single person who had a bad thing to say.
I meant the background check.
They all were very happy
Okay.
with what she presented them. There were a few glitches. A lot of people aren't used to the 2 cards, but that was the only thing. But Julie always got them fixed. So everybody I checked with was very happy with the results, the changeover, and she has also awesome customer service. So I just wanted to add that to her spiel because she can't say that. I mean, she can say it, you don't have to believe it, but I did last week check 5 different counties and/or cities, so.
She
Okay.
can't tell if she's great at it. We have to do back research, is what you're saying.
So I just wanted to let you guys know that we didn't just pick her and say that's it. We did some footwork on it to make sure that what she was telling us was what was actually, everybody gave back good reports.
Good. Thanks, Janet.
Thank you, Janet. I always tell everybody, can I guarantee 100% that any transition will be smooth? I cannot, but I can guarantee 150% that myself and my staff would be there for the support for the county, the employees, to make sure that we can make that transition as smooth as possible.
So when you say your staff, they're mostly based out of Great Bend, correct?
The majority of them are in Great Bend, and I do have 5 employees in Russell.
How many in Great Bend?
I have 11.
Oh. Okay.
Julie, will we need to do any funding to this employer claim reserve right away, or I mean, do we need to have an initial cash amount into an employer claim reserve in order to be safe in this policy, or do you feel like funding it on that monthly 135% of projected needs is sufficient?
I feel like that funding it on a monthly basis is sufficient. If you go to, for example, on the second page, based on 115 employees, where it shows the renewal plan, based on 115 employees, the monthly premium is $169,237. If you come down to Part 3 of that, what goes into reserves on a monthly basis is $61,434. So when you break that premium and you take that $169,000 that would normally be paid, and you pay for the high deductible plan of the $102, the balance goes into reserves that first month. So that first month, based on this scenario, $61,000 would be in reserves that first month. And that would be adequate that you could just fund that on a monthly basis.
So that's 61,000 every month. You manage that, or like does Janet and HR manage that?
We would manage
You
that
manage
for
that.
you. So we would work out with, and of all of my groups that we have, no 2 are the same. So again, this plan is designed for you and how you want to handle the monies. We would have an employee reserve account here in Ellis County, and we would manage that for her. We don't want to add any more duties on her than she already has, so we take care of, the open enrollment, the providing the annual notices. The white packet that you received is a packet that each employee gets. We make sure that if there's any additions or deletions to the plan, we take care of that for her. But it would be no more administration on managing that account for anyone. We would do that.
Julie, does that mean you invest with that account as well as it builds cash funds?
It goes into whatever account you open. Usually it's a money market account.
Okay.
The interest rates aren't real great there, but it's
Yeah.
it's the county money.
Okay.
So it goes into that benefit fund for the employees. And again, as that fund builds up and you look at it after the first year, that maybe you only want to fund that reserve account 6 months out of next year because you've built up those the reserve account and you pay just actual claims out of there. So as that builds, then you can decide whether you just want to fund it half a year or if you want to fund it the full year and have that money directed someplace else.
And so you have a threshold you'd like us to try to get at in that account essentially, and then we can make the decision to stop that extra funding towards it?
Yes, I like to see at least 125%
Okay.
of expected claims in there. So we go through that and educate on what's in there and make our recommendations on how it should be funded every year.
Okay.
Okay.
Well, I'm sure it won't be as simple and easy as it was before, but if it's going to save us the type of money it looks like it could save us, I imagine staff is on board, it sounds like, and I'm on board to definitely give this a shot.
Well, I think we definitely have to change from what we're doing.
Yeah.
That course has to change.
Well, we can't afford it.
Yeah, right.
Yeah.
So the process that will happen if the commission decides you'd like us to continue working with Julie is over the next couple months, we'll have several meetings through March and April and probably into May, looking at different policies. Julie's upfront and said that she can't get us prices for 2021 until they're actually released around September, October timeframe.
Correct.
But she can start looking at different scenarios. We can build the benefit plans to figure out what type of co-pays, what type of different plans. We've kind of initially talked about the two different plans comparative to what we have now, a Plan A, which is a traditional plan, and a Plan C, which is a high deductible plan. So that way the employees can still choose which best fits for the individual, and then put those out into the different scenarios and spreadsheets that she has provided you tonight to figure out in the next coming months what type of savings, or keeping it at fully funded as we are now. So come September, when we have to notify the state if we want to pull out of the state plan, we can do that. And then at that point, Julie, that's the time where the county would enter into an agreement for their services. And she's agreed to do all of this at no charge to the county this year. And we would start paying once the policies go into effect come January 1st.
Correct.
Have you had a lot of, I'm sorry, go ahead.
Julia, just asking on this, so this would be an example of if our employees had one option, but we're planning to build a second higher deductible option for our employees than this illustration.
That's kind of was the plan. We looked at our current employees currently we have 115 employees on Plan A and 36 employees on Plan C. We don't necessarily have to go that route, but just keeping the employees in mind, that's kind of just where we were at, because there are different benefits and cost savings to employees depending on which plan there are, depending on their medical needs.
So what we can do is you buy one high deductible plan, and then we can design the two different plans under the underlying plans for the employees. So like Darren said, we could have a Plan A, your traditional plan with the co-pays, and then we can design a health savings account, what the other employees are currently on under the state plan. So we could have a dual option for the employees, but as an employer, you just have one policy.
So with the higher deductible plan, that would then become eligible for a health savings account, or are both these plans eligible for health savings?
On the underlying plan, only one of them,
Okay,
because
so
we would do the traditional
Higher
plan.
deductible.
And we would do a higher deductible that would be HSA eligible.
So these other counties and cities that you switched over, they were on the state plan, I'm assuming, maybe?
Some of them were on the state plan, and when we switched them over, we tried to keep benefits as close to current as they were with the state plan. We lessened the out-of-pocket, but we did do the two plans, the traditional plan and the health savings plan underneath.
Okay.
Yeah, I think a high deductible health savings plan is really attractive to some people, people that aren't of age, for babies and things like that, where they know they will have to pay certain amounts of money. But I think that'd definitely be attractive to the employees.
Absolutely, and I feel like, and then we would do the employee education, so open enrollment meetings, we would go through the two different plan options and go through how the health savings accounts work, what are qualified expenses, and educate the employees to make that decision whether they wanted option A or option C.
Very
Okay.
Okay, yeah, let's proceed.
Perfect.
Thank you.
All right. Thank you very much. I appreciate your time, and we'll be in touch.
Thank you,
All right,
Julie.
thank you.
Okay, conditional use permit.
Good evening, Commissioners. Mason Reuter, Environmental Planning Supervisor. Coming before you tonight for the conditional use permit 2002 for Public Works for a sand pit. Just wanted to give you a little background on it. I'm here with David McDaniel, Chairman of the Planning and Zoning Commission. So I'll have him come up and we'll get her going on the discussion.
Good evening, Commissioners. David McDaniel, Joint Planning Commission Chairman. This is in regard to CUP 2002. This is for the Ellis County Public Works sand pit in the northwest part of the county. All the property owners were notified about this situation. All the fees have been paid. The sign was made and posted as required. A public hearing was held February 26, 2020. Kurt Hoffman represented the county in that public hearing. The committee approved the CUP with the condition for a reclamation plan. I don't know that that's been accomplished yet. The protest on this ended March 11. There were no protests, including as of today. No protests have come forward. As always, the commission can approve this recommendation, disapprove our recommendation, or send it back to the committee.
Do you anticipate getting a reclamation plan for this project?
Yes, I do. I believe Bill Ring and the Public Works staff already have one drawn up and filled out with I think KDHE, and then once this goes forward, they can sign it and submit it to us right away.
Okay, great. Okay, gentlemen, any discussion?
Seems pretty cut and dry.
Pretty cut and dry to me, too.
Do I hear a motion?
I move that we approve CUP 2002 to allow Ellis County to utilize a sand pit located at the 1500 block of Saline River Road in rural Ellis County, as the zoning regulations have been followed and approved by the Planning and Zoning Commission on February 26, 2020.
Second that motion, Mr. Chairman.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Aye. Motion passes 3-0.
Thank you, gentlemen.
Thank you.
Thank you.
Okay, Sheriff's Office. Under Sheriff Brown.
Good evening, Commissioners. Sheriff Harbin couldn't be here, so he asked that I come in his place. As requested a couple of meetings ago, you indicated you'd like us to come back and speak with you about filling some positions that are going to be coming vacant. We will have 2 from our jail staff that are going to move on, and we're just letting you know that we started to advertise for those. And as requested, we're obviously we're needing those positions with our jail staff, and so we just want to make sure that you guys are on board with us.
Mm-hmm. Scott, do you have a hard time hiring jailers? I know at one point it was difficult.
You know, surprisingly enough, since we've opened it, and we opened it up about a week ago now, we've got 8 or so in there, and there's some pretty darn good applicants already. So not really. We have been very, very fortunate. Our young people up there have friends at Fort Hays and other places, and they're saying, hey, come work for the sheriff's office. And so we've had really, really good luck with that, and we hope that keeps up. So like I said, we'll have 2. One of them is looking to leave in April, and we've heard that the other one is looking in March. Anyway. Yeah, obviously, we have the money in our budget, so currently, because we're just replacing what we have.
And if you didn't have these positions filled, it does create a problem in the jail.
It does. It's going to create more overtime, without doubt, and which is what we're trying to curb right now, currently. So,
Absolutely. Okay. Well, I'm on board with it, gentlemen.
Yes, sir.
No problems with me.
Yeah.
Get them hired.
all right.
Hired.
Thank you, Commissioners.
Okay.
Thank you, Scott.
Jason.
Jason Kennedy, Ellis County Health Services. Like Scott, we have an open position due to retirement that I was notified of on Friday, actually. One of our longtime nurses, it's been with us for quite a while, but she's actually going to retire. She put in her 2 weeks notice, so we're going to have an open position for a nursing staff at the health department that I'm requesting to refill. And then I was also notified today, this morning, of a paramedic position that actually the end of April she gave me notice that she will be leaving. So it wasn't originally on there, but I was notified today of that, so I would like to request to refill those 2 positions. With the health department position specifically, we have looked at possibly opening it up to maybe an LPN staff level, which is 1 step down from a registered nurse. At this time, I honestly do not have the best information to provide you guys on that. What I would like to request is really the ability to use my judgment within the scope of work that we need and within our current budget to make the best decision moving forward. That'll allow us to open up really the candidate pool. We can promote it for either position and really hire the best candidate that fits our position within our current budget level. And then on the paramedic side with EMS, what I have done for the last couple of years is we have looked at our current staffing models as far as numbers of paramedics, and we have hired the best person for the position, whether that is a paramedic or an EMT. Obviously, we want to promote and hire the people that have the certification levels that we need, but we also want to hire good people that will value the organization. So kind of on the same page on both organizations that I would like to fill those with the best candidate.
Sure. I know, hiring a nurse, there's a lot of good LPNs out there too.
Right.
And it could save the county a few dollars if we could do that.
Yeah.
When your nurse retires, that would only leave you one nurse in the department, is that correct?
Yes, sir. Yep.
And the department isn't very functional with one nurse.
No, it really would be it would be impossible to function on a day-to-day operation. Now, we obviously anything is plausible and we could set staffing, but especially right now, this is just not a time to think about reduction in staff at the health department. We really are overrun, and with the 2 nurses, we're able to provide the same level of service every day to the community, and we do have people that need to take a vacation. So if Carla's not there, it would completely change our normal status or our normal ability to serve the community, and that's just not something that I think is in the best interest of the community.
Right. I think at this point, it's prudent to keep our health department up and functioning. Gentlemen, any input?
I would say, with your judgment on both positions, feel free from my perspective to hire and find the best candidate for either job.
I agree with both of them.
I trust your judgment.
Sounds good. I appreciate it. I did want to give you guys a quick update on the COVID-19 stuff while I'm here. We did meet with a community task force today. We actually put together a community task force. We tried to represent a large cross-section of community stakeholders and really get everybody in the room to hash out some ideas on what we need to do and to see if we were all prepared. I will assure you that the overwhelming consensus in the room was that we are prepared and have been preparing for this for a long time. We've had the policies in place. We're moving forward with those. We had representatives from the healthcare community. We had representatives obviously from Ellis County, from the sheriffs, from the city of Hayes, from the schools, and that we have been preparing for this and we are prepared. On the health department side, we will continue to monitor and assess the situation. We do not currently have any cases of COVID-19 in our community in Ellis County. We have no confirmed cases at this time. Obviously, everybody, or I hope everyone has seen that the president did issue kind of new orders today from the CDC. That information is available at the cdc.gov website. It's up at the top. At this time, really the biggest thing that we want to encourage Ellis County residents to do is to seek out factual information. Utilize good factual sources for information. CDC, KDHE are both great resources for information. They have information specific to your organization, your situation, and whatever that is. So reaching out and making sure that you're getting that good factual information and you're staying up to date with what the CDC recommends. The biggest thing from the president's address that I do want to hit is that the most important thing we can do right now is standard precautions, making sure that we're practicing good hygiene. So that is washing your hands, especially after touching any frequently used item or surface. Avoid touching your face, sneeze or cough into a tissue or the inside of your elbow, and make sure that we're disinfecting and we're taking care of any flat, hard surfaces. So at this time, those are still the best recommendations. There is more to it on the CDC website. Like I said, I encourage everyone in Ellis County to make sure that we go out and get that information and make sure that we're utilizing good factual data. So is there anything else I can answer for you guys tonight?
No, not from my perspective.
All right, Commissioner, I appreciate it.
Keep up the
Thanks,
good work.
Jason.
Okay.
This look like baby consultants back there.
Are those our consultants?
Commission Chair. Amanda is here from the courts. I don't know if she has anything about court closure.
Amanda, did you have anything to say?
Okay.
Anything change in the court system with all this? Yes? Can you share that? No. Okay, forget that.
There will be further orders coming. The Supreme Court just issued an order at 4 o'clock, and I would anticipate Judge Brown is working on one as well.
Okay.
So nothing, so far as the county, municipal court, all that, everything county court-wise, it's all the same?
No, municipal court has stopped all municipal court hearings until April the 6th.
Oh, wow.
We do have policies that who can enter the building and when an employee has to stay home based off of their temperature, but all of that is dictated by Kansas Supreme Court.
So I guess we'll see a further update soon, huh?
There will be a further update hopefully tomorrow.
I see.
Okay.
Thank you.
Good information.
Okay, county administrator search consultants.
How are you guys today?
Good.
Hanging in there.
Dealing with some of the same things we've been talking about in City of Dutch.
If you can make the price of oil go up and the price of crops go up, our commodities, you're in.
Hi, everybody. Thanks for having us. My name is Don Osenbaugh, and this is John Deerdoff. I think you have our information probably some time now, and so you know a little bit about us. We are a team and work as search consultants for, to this point in time at least, primarily cities. But the plan would be pretty much the same as we've outlined in our proposal. And so we've been pretty busy lately and have had an opportunity to do quite a few searches, and it's been going well. And I think that the model that we have presented to you works. And I think it works well. And I think there's some advantages to what we do that are maybe a little bit different than what others do. And that's kind of why we're in the business to begin with, because we thought we could come up with a way that maybe close some of the gaps that we saw in some of the other processes. And so I'll give John a chance to talk too a little bit.
Yeah, so I'm John Deerdoff, and currently I'm the city manager of Hutchinson, and I'm retiring. Was going to be effective March 27th, and so my council knows that I've been helping Don a little bit on this, and so unfortunately they've tabbed me to stay another month. We've got a new hire there that's going to start in May, and so I've been helping Don, but the whole process is a lot different, and one of the things we're finding is that for a lot of these jobs there just isn't as many candidates as there used to be, and a lot of that has to do with the profession, not that many people going into the business. And so one of the things that I think we're really strong on is, we'll talk with you about the profile and what it is you all are looking for in your next county administrator. And we'll put that out. We'll put it in the various places. But we're not just going to put an ad in the paper, so to speak, we're going to be tapping people on the shoulder. And we've got a real good network of city and county managers that we know around Kansas. I've already talked to a few to get some ideas on county management and what that market looks like. And so that's a little different model than sometimes you'll see in some of the bigger organizations. It's not as simple just to place an ad. I mean, you really got to go out and network and tap people on the shoulder and say, hey, you ought to look at this opportunity. And I think I've been in local government for 40 years. All of it's been in Kansas, served in Dodge City, city manager Sterling, and now in Hutch. And Don's worked the city of Halstead for 12, 15 years, something like that. And so, and plus, what Don does now with KMAT, really rubs elbows with a lot of city officials across the state. So,
He highlighted one of the differences that we see ourselves doing, and that is that we know people. We have contacts. We can talk to people. Another one is that our first round is after the resumes come in. It's John and I, and typically two others. For this situation, we would add a third, a recently retired county manager who's a friend of both of ours, to add a little bit more of that element to it. But we'll all separately review, rate, and rank every application. And the beauty of that is that, in this case, 5 different sets of eyes, all of them, I don't know, between the 5 of us, probably 175 years of public management experience. We know what we're looking for, and we know how to get to that. And after that has been done, John and I will review the results. We'll make follow-up phone calls. If there are aberrations in what we've discovered, we'll follow up on those. We'll be able to get you then a grouping at the top of that of, I think the common numbers I like to use are 7 to 10 people that then we'll bring back to you, and all of us together will decide which ones of those are going to come in for an interview. So it's a pretty thorough process getting to the end, and we stay with it to the very end, which is also something that maybe others don't do. So there's some elements there that were by design different than you might see somewhere else, and we're Kansans. We're both, I'm a native. I actually am a native of the town that he's the manager in, but we've lived and worked in Kansas our whole career, so we know how the systems work, we know how the budgets work, we know who might know that, who might be best suited for the job. So we think we're ready, and we'd like to do your job here. We did present, I think, to somebody.
Yeah, to Darren, yeah.
Darren?
Sorry.
Darren, okay, well, we don't know faces here yet.
I'm going to email Darren, but yeah.
But we have presented a sample contract. I don't know if that was distributed or not. So if it was, you have that. That is our more or less standard form. And the time frame would be that typically we like to kick things off with sort of a collective meeting where we talk about attributes and those kind of things. And then we post, and then there's a 5-6 week period. And then we take another week to review the resumes, and we come back to you. You will all see those 7 to 9 or 10 resumes, and we'll come back to you for that selection meeting. And then there'd be a third time, and on the third time would be interviews, and they would all be the same day, one after another, with hopefully a decision at the end of the day. And so that's been our model, and it's working pretty well. We all know that the complications of the last few days are going to have some effect on everything all of us do. We're not sure how any of that could affect schedules in the future. I'm not sure how to know that. I know what the normal time frame would be, that we'd want to come back and meet with you, and as soon as possible, and then we would post it, and then we'd wait 5 or 6 weeks, and then we'd have a second meeting, and a couple of weeks we'd have, so you can kind of look at your calendars and figure out where that takes us. But again, I don't know how long everything's going to stay the way it is today, but that would be what we would anticipate.
Yeah, and I think part of what Don said, that next meeting or that first meeting is really the important one to kind of hear from, you all as to, what you're looking for in your next county administrator, and kind of work through that whole conversation, what kind of experience, what kind of education, those kinds of things. But I think really we would be happy to address maybe any questions that anybody has at this point in time, and what you're looking for.
So when you do your search, I mean, is that you're going to do it clear away from Kansas also, I'm assuming?
Yes.
Yeah, we tend to, here's what we've been doing, and probably we would do it here. We publish in, the Kansas Association of City and County Managers, Colorado, Missouri, Oklahoma, Nebraska, Iowa, kind of the region. But they all, but in reality, it goes all over the country. Once you get it in any of these sites, it tends to find its way. And but
we'll get them. We'll probably get resumes from other places in the country.
Yeah, And if you have some specific areas, we'd look at that, but primarily, a lot of the work we've done with cities, that they kind of like that approach from, this part of the country, if you will. But it does spoke out to all over the country, really. And so when people say, well, we're doing a natural or a national search, or we don't want a national search, I don't know if there's such a thing as a non-national search way with the internet and everything.
We've actually observed several national searches that have been done in the work that we do in the last few years, and all of them hired people from Kansas that we knew. So most places in Kansas are more comfortable with someone that knows the culture of this part of the world. And so we don't necessarily think that you should limit it to Kansans, but truly, people from this part of the world get the culture a little bit better than somebody from, I don't know, Florida or some other place. Did you have a question, sir?
No, not
Okay.
right now.
I have a couple questions. Maybe they might even just be my concerns, I guess, as we get started in this process. How many, you guys have a list of conducted searches and stuff. How many times have you worked with 3-member boards of elected officials and the uniqueness of dealing with the Kansas Open Meetings Act and stuff like that? I know you had
Well, first of all, Kansas Open Meetings Act already applies to everybody that we deal business with, and that doesn't change.
Yeah,
yeah. We've worked with 3-member board in Winfield.
Winfield, we did.
Yeah, the
Okay,
first
so you
year.
have
We've
before.
actually worked with them twice, and they have a 3-member board. At the extreme, on the other end, is we've worked with a group that had 10 council members elected by wards in a town of 20-some hundred people,
Oh,
which
wow.
means every ward contains about 6 people. No, not that many, but you know what I mean.
That sounds like a nightmare.
10 council members plus an elected
Yeah.
mayor, and half of them were elected every year. Not every other year, every year. So the gamut can range, but we have worked with 3-member
But I think on the open
commission.
meetings, I mean, that's something we always kind of rely on the local city attorney or county councilor to advise you on how that works. Typically, the way we've worked and our understanding of the law is that, once you get into the interview process, that can be done in executive session.
Okay.
At least that's our opinion, and that would be your
Well,
council's decision. And
I'll take a step further from the acting manager here. That one must be done, as far as we're concerned, in closed meeting.
Yeah.
Our second meeting, where we're selecting from a group, and you have that in your hands, and you know all those names, and the names are going to be discussed,
Yeah.
we want that one to be an executive session. We just met with the city of Ellsworth a week ago tonight, and they actually followed our true model, which we would actually prefer to have all the meetings in open session, because at the very first one, names can come up. We don't like names to come up. We think that's a private employee issue.
Okay.
We have conducted the first meeting in open session. It is not our preference. That is
That's
kind
your-
of,
yeah, that'd be your
But
call.
we'll tell you our preference would be that all 3 meetings, because of names.
Yeah, I'd imagine
Privacy.
executive session is the best
Yes.
on that.
Yeah.
Okay.
Yeah, that's understandable.
The only other concern, and it's just from staff, is that most of what you've done, like you guys have said, is city officials. And I think this county has dealt with that in the past, in the idea of hiring somebody who was very familiar with city government and not so much county government, and then posed issues over their tenure because of that. So I'm excited that you guys have talked about bringing somebody on with a lot of county experience as well in the process.
And by the way, we're connected with other people with county experience.
Okay.
Yeah, and I think that's a legitimate question, a legitimate concern, and, I've worked with counties my whole career, and I don't say I know how counties operate internally, because it is different, and I'll give you that, it's totally different. But at the same time, managers, just management is management, engaging with people, engaging with citizens, working with governing bodies. And so there's a lot of crossovers, and, at our city manager conferences, we're the Kansas Association of City and County Managers now because of that. And so, we talk to a lot of county managers, and so I don't think that should be a concern, but I certainly understand the question.
And the 2 fellows that we know best, I think, and one will be on our team, have had both experiences, and in fact, both of them said virtually the same thing. When I first went into this, I thought, wow, there are going to be a whole lot of differences. And they both told us there are more similarities in public management than there are differences. My own view of that is everybody comes in with a different style and a different personality. And the fit matters most. It doesn't matter if you're in a city or if you're in a county. The fit matters most. That's why those two discussions that we have with shrinking it down, because we really are after, ultimately, we're after the right person for you, this group, at that point in time.
Yeah, and I think that happened with our previous administrator where he came in from a much larger area, but was able to adapt very well to.
He was a Kansan too, wasn't he?
Yes, he came from Kansas originally, so.
County, from
yeah, he
Kansas.
was county to
Yeah.
county, but he, you know, from what I've heard from staff, he immediately came in and said, "I'm not here to change your county. I'm here to adapt, help you be
Right.
better," that type of thing, and sometimes too much gumption is almost the worst thing.
Yes.
So, but yeah, so I'm glad to hear you guys have brought some, you know, county on, and I'm excited to get started with the process.
But we'll definitely be shaking those trees in the county side and county world and have a lot of those connections, so.
Very good.
Dean, you have any questions?
I think they're doing a great job on their presentation, and Dustin asked the questions I was going to ask about county experience, so, well, I'm comfortable with that.
Yeah, I think we should proceed.
Well, thanks a lot. We have, you always come equipped, right?
Sure.
Got pretty much everything I need
You wanna
to
leave it
give
with
to
Darren?
somebody to process this and get us going.
Oh, yeah, yeah.
There's a
Just wanna
signed
leave it.
contract in here.
If
You
you
want to
want-
sign it tonight?
Yeah, if you want to give it to the clerk, then we can get that all taken care of.
Okay.
You reviewed it all correct?
Yes.
You've reviewed
Yeah, I
it?
reviewed the contract.
Okay, very good.
And it
It's pretty
meets my
straightforward.
legal review.
Okay.
And you do need a motion and a vote to
But you need
approve.
a motion to approve that.
Okay, we'll need a motion to approve the contract. Do I hear a motion?
I move we move forward with Ozenbach Consulting in the process of hiring a new county administrator and allow the chair and other commissioners to sign said contract.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0.
Just one quick, as far as contact, we typically like to have kind of one individual, I mean, obviously you all be involved, but just that major point of contact, whether it's a chair or
Timing of next meetings and all that kind of stuff.
working with Darren.
Probably
I work with
Darren.
Darren.
Okay.
All righty, we'll do that.
Is that fine?
That'd be the best, and he can reach out to us.
Okay.
Yeah.
He would be-
He has direct contact with us all the
All
time.
righty.
He's been very good about getting back. to
Well,
us, so.
there'll be some details and we'll get on them.
Very
Thank
good.
you.
Sounds-
Thanks
Look
for your
forward to working with you
support.
guys.
We'll get this
Thank you.
together for you.
Thanks a lot.
Yep, thanks for
Good luck
coming out.
with the other stuff we're dealing with, so.
Yeah, thank you.
Okay, the 2021 budget presentation. Darren, you have anything to say?
Yes, sir. Before you, in each of your packets, there is a detailed breakdown by department for each of the budgets as prepared. As the commission is aware, you asked for a 1% reduction overall through each department. And as we went through salaries, as we went through everybody's budgets, the departments did a great job, and I thanked them a couple days ago. They went to exceed what you asked. They got about a 1.35% reduction with the total budget where we have. I think we are a little too lenient on the revenues. I think we over budgeted those, so we'll probably need to consider those. And in all honesty, the revenues at this point are we can't be too accurate on them because we don't have the exact figures from the appraisal department. We don't have information on oil and gas. We don't have information on health insurance costs. So, well, I guess health insurance doesn't necessarily have to do with revenues, but what we have preliminary shows is that the 1.35% reduction, and I thought we would just go through each department real quickly. I don't know how much time the commission would like to spend on them, but I at least give you a couple pointers from what the departments had kind of proposed with any different changes. I know each of you had a couple different questions in regards to them, but
I think from visiting with my fellow commissioners, we're going to defer this till the next meeting. And it gives us a little more time to go through each budget. And we'll look at that then in April, the next meeting.
You want that on the first meeting in April then, or do you want
Yes.
to wait until the
No,
second?
First meeting. That gives us 2 weeks.
We don't have a meeting next week, no?
No,
Oh,
this is the third one.
I'm sorry, I'm in February over here. Sorry about that. I was gonna say, my calendar says we have one next week.
That's okay with you, Dustin?
Yeah, that's fine with me. I would say that, yeah, I had a couple of those concerns as well. The one question I wanted to ask as I'm looking at this is, did we make an adjustment of that approximately 8-9% to the health insurance, or do we keep it flat?
So all the budget numbers as of now for payroll expenses are of county employees' current salaries and longevity. And then for healthcare, it's what they're currently paying now.
Okay.
Once those adjustments come in, once we get those numbers later in the year, I think around June, July, we'll get the 2021 numbers from the state. Then we'll be able to plug those in, and
So no adjustment
honestly,
of,
that
okay.
1.35% decrease is probably going to go back up.
The county employees are scheduled to raise in July, I believe. Those
Well,
numbers aren't in the budget?
Yes and no. So they are, but they're not. They're not actually in each individual department's line items.
Okay.
They are held into the budget stabilization account.
Oh,
And
okay.
it's not necessarily until July. It's up to the commission on when you would like to address those for the employees, on when you want to make the raises. We can do that in April if you like. The money is, like I say, not in their departmental budgets. It'll come, we'll have to determine what percentage raise you want to give, how you want to give it, and then we will transfer the money out of the budget stabilization account into each line item for the individual
Sure.
departments, make the budget adjustments for that. So, yes, the money is there, it's just not there until you determine exactly what and how you want to give that raise and when.
Okay, sounds good.
We budgeted $150,000 for that raise. And now we are down a little bit on that.
So a little history behind that. We originally budgeted for, put in the budget stabilization account for a 3% pay raise. That
Okay.
was at the beginning of the budget season last year. And after reductions in trying to decrease expenditures, decrease costs for the county, that was reduced down to 2%. Right at about 150,000 is what we have. If you do remember, earlier in the year, we did reduce that by, I believe, $12,000 for the elected official salaries. So we're down to around 140-some thousand is remaining for salary increases.
I think when we budgeted for those raises, we were going to put in what the Social Security increase not to exceed 2%.
Yes, there was discussion on that. There was no direction given by the commission on when or how. But the point of discussion at that point was to go back to, at a certain point, have the Wage and Benefit Committee address what you would like to do, and then have them address you with what their proposal is. I think there's a little bit of two different thoughts from what the Wage and Benefit Committee is recommending. I don't want to speak for them because we haven't discussed that specifically in depth yet. We've been focusing on the health insurance.
Sure.
But if you would like, I can speak to that chair, and we can have them come to a commission meeting next month and, present what they would like to do for that same amount of money. It's not, the same amount of money would be expended, but it may be implemented in a different fashion. I know one of their main goals is to try to get that the Evergreen study, the fifth step final, and completed it, and behind us. I know county staff is really would like to say we completed a pay study to its fulfillment of what the plan was, get it behind us, and move forward from there.
What did the COLA end up being for Social Security?
I believe it was 1.6.
That's what I was thinking. Okay.
Okay,
But
sounds good.
If you like, I can consult with them and have them meet to come together with a proposal. And if you want them in April, or if you want to wait until a different month, that's your choosing.
I don't know that it really matters that much, since the money's already in the budget. It's in the budget, just a matter of how it's going to be expended. So let's first just get our budget figured out, and And then they can make their recommendations on what they want to do with the money, what's in there.
So next month, or do you want to wait until?
I would say the sooner the better if they can get us at least a recommendation, and then we could, go from there.
That's fine. Next month is fine.
I will look at the schedule, see what all we got, and give them some time to have a meeting and be in touch.
The initial idea was a July timeframe.
Dean might remember more, but I think it kind of varies around those summer months, just depending on when action was taken.
Mm-hmm. And how much, okay.
Correct.
Correct.
Okay. Okay, moving on. County Administrator report.
The only thing I wanted to bring in light to the commission would be, if you remember last week, we had Secure Energy Consulting come in and produce some pricing for energy. As of that night, and then between the next morning when he spoke with Commissioner Hazelhorst, the price actually dropped by 4 cents. So when he brought me the contract, instead of it being at 310, it's at 306. So I went ahead and signed that since it was cheaper than what he had originally proposed that night before.
He said that night he was looking on the computer and he had a chance to change it like at 3 o'clock in the morning, and he sends me a text. He says, "What do you think?" I says, "I'd say do it. We're saving the county more money. Why wouldn't we?" I said, "I don't think he'll hear any objection."
Yeah.
And he said by the time he got in there, to me that afternoon, it had already went up like 13 cents.
Yeah, it did. It went up after that. It went up like shortly after like 9 in the morning. It started creeping up. So.
Caught a low mark. Good.
Yep. And once in a while you luck out.
That's all I got.
Okay. County Commission reports.
Sorry, sir, I have nothing.
Okay. Commissioner?
While everything was going on last week on Thursday and Friday, I made a trip to Pittsburgh, Kansas, to look at some of the stuff that they do in downtown Pittsburgh, meet with one of my Leadership Kansas classmates who is pretty influential in that community in developing their strategic plan. And it was really informative, and I'm going to report to the strategic planning committee that was started through strategic doing. And I think we have some good things that we're going to concentrate on, and once we get that strategic plan put together, there's no name for it yet. We're working on a name for what we want. But this will be a 10 to 20 year strategic plan that encompasses things from health care to child care to housing, all things city, county, private entities, trying to work together going forward. So I'm excited about what I learned there with their downtown and the things they've done there, and that was most of the trip, was seeing their downtown. But we also got to go around and look at housing projects. We got to look at the way their cities and counties work together. Frankly, it was amazing to me, the mirror image that Pittsburgh almost is to Hayes, in the sense of leaders in the area that they're at, the size of their community. They're about 20,000. They have about 2,000 more on-campus students than us, but we have a larger university as a whole, so we have more employees than their university. It was a fun trip. I learned quite a bit, and I'm excited to bring that to our strategic planning committee as we go forward. That's all from me. Just a little bit of guidance in terms of what's going on in the financial and health world right now. Is diligence in your life is really helpful. Concentrate on being diligent and doing the things that you can do through tough times like this. So. That's it from me. Thank you.
And I have no report either. With that being said, the commission meeting will adjourn
6:18.
at
6:19 now.
19, 6:19.
6:19.
Thank you.